What is my date of delivery? How pregnant am I? When will I have my baby? How many weeks, months? What is this all about? Okay, so I can't tell you exactly when you are going to have your baby. I wish we could, but we don't. Babies have a way of coming in their own good time. So how pregnant are you? What is your due date? Weeks, months? I can try explaining that to you. So how do we calculate? We take the date of your last menstrual period. All right? So when you come to us, you should know the date of the start of your last periods and how your previous cycles have been. Have they been 28-day regular average cycle? Are they shorter, like 25, 26 days? Are they longer, like 30, 32, 35 days? So with this information, these two pieces of information, we calculate. We add 9 months and 7 days, right? So it's 9 months and 7 days from the start of your last periods, that is your due date, right? So this is assuming that you have a regular 28-day cycle, and this is assuming that you got pregnant on around the 14th day of your cycle when the egg is released, right? Look at the normal cycle, study it so that you understand all this better. So let me tell you about the normal menstrual cycle and why I mentioned that you ovulate on the 14th day of a 28-day cycle. The menstrual cycle, first half is the half where the egg develops. The follicle, which is the bag containing the egg, it gets larger and larger and larger till a point is reached where the egg is released. That's ovulation. In a 28-day cycle, that happens on the 14th day. In a 25-day cycle, it will happen earlier, 3 days earlier, maybe on the 12th day or the 11th day. Because after ovulation, to the start of the next periods is a constant. It's always 14 days. The first half of the cycle can be different. You can ovulate on the 12th day or the 14th day or the 16th day, and accordingly your cycle will become less or more. Now this is important because when we calculate your due date, we are calculating according to average. If you have a smaller cycle, your due date will be maybe 2 days earlier. If you have a longer cycle, your due date may be 2 days later. We have to keep that into account. And another thing that we do to ensure that we get your dates right is do a scan at around 11 to 13 weeks, which is called the dating scan. And also it sees for a particular abnormality, which is NT, nuchal translucency. It is checked to see if it is normal or not. In the dating scan, it confirms when your due date should be. Because later on in the pregnancy, different babies grow at different rates, right? So each baby, according to their genetics and their parent sizes, may grow slower or may grow bigger. Girls generally tend to be smaller, boys tend to be bigger. So we don't base our calculations of due date on subsequent scans. You come to us with a scan and you say that this scan says my due date is 4 days later. At 30 weeks, you're maybe having a smaller baby which appears to be, due a little later, or a bigger baby which may be due a little earlier. That does not change your due date. Ultrasound is only valid as a predictor of due date in the first 3 months. So when we calculate the date, that's 40 weeks. How is it 40 weeks? Is every month not 4 weeks? Every 3 months, every trimester, it's not 12 weeks? It's not, because every month is not 28 days, it's 30 or 31 days. So when we calculate, then every 3 months is 13 weeks. If the next 3 months is again 13 weeks. So at 6 months, you are 26 weeks. At 9 months, you are 39 weeks. On your due date, you are 40 weeks, right? I hope this makes sense to you, because weeks is how we talk, Months is how patients like to know. So when you are talking about months, either you can just take your last date of periods and calculate months accordingly, starting on the same date every month, your 2 months, your 3 months, your 4 months. But we tend to talk in weeks, because that way we are all in agreement on how pregnant you are. So when will you deliver? Again, exactly I can't answer. We would like you to deliver after 37 weeks, because that is when you are full term. So 37 weeks is 3 weeks before your due date is when you are full term. That means that if you go into labor, chances are that the baby's systems are all okay, especially the lungs, and the baby will have no difficulty in the outside world. Before 37 weeks, we call it preterm. And the more preterm a baby is, the more chances are there that the baby will face problems, mostly respiratory issues, and the baby will land in the nursery or the NICU, which is the neonatal intensive care unit. So we want you to deliver at full term, 37 to 40 weeks. But there is a period of term pregnancy, which is all right, which is after the due date. You are still in your full term up to 42 weeks. That is 2 weeks after due date, you are still normally full term pregnant. We prefer that you don't wait for 42 weeks, because in our population, Pakistan, India, after 40 weeks, there's more chance of baby doing passing their stools inside the mommy and then getting into distress. In the West, in the Caucasian population, generally it is safe to wait 41, 42 weeks. And what do we do when we don't want to wait any longer? Whether it's 42 weeks, 41 weeks, 40 weeks, then we induce. We give artificial pains. By inducing, we mean that there is no labor. There is no pain, there is nothing, no sign of labor, and we start labor from zero. We start labor from scratch. So when we do that, there is an increased chance of landing in a cesarean, because things have not started naturally, and whenever we do these things, we do increase the cesarean rate, but not dramatically, because leaving baby inside is going to cause the baby to pass his stools, and that will also lead to a cesarean. So you have to trust your doctor that if they want to induce you, that they know that they have weighed the risks and benefits of waiting versus inducing, and that they will make the right decision for you. You should not really argue about it, but you must discuss it with your doctor. It should not be for just convenience, because someone's going on a vacation and they want to deal with all their patients before they leave. Because if you're not ready, if your cervix is not ready and you are induced at say 38 weeks just because it's convenient for the doctor or whatever, then you are unnecessarily putting yourself in a position where you will land in a cesarean. So I hope you've understood there is how the due dates are calculated, and I hope now you understand when we talk about weeks, how many weeks you are and how many months that translates into. But still I can't tell you the exact date you will deliver. Thank you.